Hey, it's Dr. Cody Rall with Techforpsych, coming to you from New York City today for the 2018 Psychiatry Innovation Lab. We're sitting down with Shrenik Jain, founder of Sunrise Health and winner of the $10,000 grand prize for the Psychiatry Innovation Lab. Sunrise Health is a peer support system that augments regular therapy and has gained a lot of momentum in recent years. So we're going to talk to Shrenik and watch his pitch. I can't wait. Hope you enjoy it. Thanks so much to our sponsors, including our main sponsor this year, Otsuka America Pharmaceuticals. It's Dr. Cody Rall here with Psychiatry Innovation Lab. I got Shrenik Jain here with us from Sunrise. Thanks so much for being here today, and super excited to hear your pitch. You were actually at the October Psychiatry Innovation Lab, and it was 2017, right, in Washington, D.C.?
Yeah, I want to say so. We started this company out of Johns Hopkins in Baltimore, so that was right in our neck of the woods around then.
And you guys have had some crazy growth since then, it sounds like. Could you tell us a little bit about Sunrise and how it's kind of built up momentum?
Yeah, so my co-founder and I met at Hopkins as students, basically with the idea to create a platform that would allow this idea of a peer support group, really that's super ubiquitous in behavioral and mental health care, and actually make that accessible 24/7 and integrated with the rest of clinical care itself. So we have a mobile app that allows patients to get 24/7 peer support, and on the back end we have proprietary AI tools that allow us to pick out clinically relevant information in these messages. So the providers can be directed to the patients most in need of help exactly when they need it, based off what they're saying in their peer group.
And that kind of grew out of your experience as an emergency responder, correct?
Yeah, so I worked as a firefighter and an EMT. I've done that since I was 16, and wow. Initially, I saw a lot of patients with overdoses, suicides, but really the straw that broke the camel's back for me was I saw a fellow first responder, actually someone I was very close with, let's call her Heather, who suffered from PTSD and substance use issues after we responded to a domestic homicide. And for her, really, we had clinical therapists for free in our department. There was just so much stigma attached to those resources that she was just unable to use them ever.
Yeah, and so you guys are building out this platform for peer support, and I remember, listening to your YouTube video for the submission online for the Innovation Lab, and you're talking about like all the evidence that there is for peer support. It's like a very powerful medium, and it helps augment other treatments, right?
Yeah, well, I think firstly, the first really powerful thing about peer support is that that's where the patients are, right? Majority of the people with substance use conditions don't get any care whatsoever, but it's really these grassroots community type initiatives, AA, 12 steps, that most people are getting most of their engagement and care from. And there's definitely problems with oversight and all that, but that's where the patients are. So we saw that as our duty to make the care more patient-centric and reach them where they are. But there is so much literature around the efficacy of these solutions. I mean, there was a Kaiser study that I mentioned in my pitch that says that of 150 patients that were admitted to an ER for an overdose, 70% of them could be convinced by peer coaches to return to care. And when clinicians tried to do the same thing, they asked these patients to go back into treatment, not a single one, not a single patient out of 150 actually went back into care over the 3 months they tried to do that.
Yeah, and I mean, with the shortage of providers in the mental health field right now, I mean, we need like all the help we can get. So really appreciate you working on this problem. And you guys have built out a pretty techie side of things as well that I wanted to ask about, some proprietary AI that's actually responding to people. Could you talk about that a little bit?
Yeah, well, we're engineers by training, and really the thing is, everyone who's applying AI in this space is focusing on things like bots and screening tools. And those things are great, right? They're helpful. We need all the help we can get, like you said, but they don't follow patients throughout the lifetime of their chronic conditions, right? That's really substance use. And what's more is, like, a bot doesn't provide the same kind of empathy and validation, the empathy that you find in peer support that's validated in literature. So really, we had to build something that could follow people through care and look at conversational context. All the existing sentiment analysis tools, we're just looking at a much higher level. Is person A suicidal or not? Is person A a drug user or not? But beyond that, how do you know what's the difference between a bad day and a relapse day? So yeah. We built that out in-house. Our chief medical officer and clinical advisor, Dr. Jariam, a professor of psychiatry at Hopkins, worked with our data science team from day one and really helped us build something that would help providers in the field.
Wow, that's really impressive. Just like taking, the clinical expertise and combining it with the actual digital expertise and making something happen. Just like amazing. What do you guys hope to learn or to connect with here at the lab today to help further your mission?
Well, I think fundamentally our mission has always been twofold, right? I talked about making the care more patient-centric, but the other thing is recognizing that there's many hardworking providers out there who are very specialized to their patient populations. And we see a lot of solutions that are going direct to consumer, you know, they're selling these upmarket wellness type solutions, but we're really different in that we actually we license with the existing providers, right? We're a platform for existing social workers and case managers to work with their current communities. So really being here where the providers are is important for us, not only to get feedback, but also to find partners for pilots as well as potential funders.
That's awesome. I can't wait to hear your pitch.
Thanks. Looking forward to it. Thanks for having us.
All right.
They were finalists for TechCrunch Disrupt in New York City, and then rebranded as Sunrise Health, and are now joining us here today. He enjoys putting stickers on his laptop, but not for artistic expression, but really to hold his computer together, #StartupLife. Shrenik Jain.
Thank you. So I'm going to start by asking everyone here to think of someone they know with a substance use issue. So who comes to mind for me is a close colleague from when I was a firefighter in the EMT. Let's call her Heather. She was suffering from PTSD and substance use issues after a domestic homicide. Now, she wanted to stop drinking, but every time she would take a step back, relapse would hit her like clockwork. And literature would say that in a setting like this, peer groups can make a huge difference. Until we can control the relatability can't integrate it with the rest of clinical care. That's why we built Sunrise Health, a mobile platform for text-based group therapy and peer support that uses AI to keep these groups safe and scale the efforts of existing clinicians. We are a wraparound service to existing substance use treatment that combines the persistence of peer support with the clinical efficacy of therapy. Users can join small groups that they text 24/7. These groups are moderated by clinicians, usually a social worker or a care manager, sourced from the organization we're working with. This kind of 24/7 access is only feasible because of our proprietary AI tools that understand the emotional sentiment and messages. This allows us to catch critical content in real time, keeping groups safe and catching complications early. We have a B2B SaaS business model where we license our platform to organizations with existing mental health care providers. Initially, we're focused on substance use because it's a traditional peer support coupled with the opioid crisis creates a pressing first use case. In patient settings, we're a tool for high touch point care, and in the newer outpatient medication-assisted treatment, we're a way to limit retention. Fundamentally, our vision is to become a population engagement tool across the spectrum of behavioral health care, allowing patients with a personalized gateway into the rest of their care while taking the load off thinly stretched care management teams. Other opportunities exist, working with universities or even scaling our AI tools on their own as an API service. We have early validation from our approach through a proof of concept we did with Johns Hopkins. We're using our platform to complement traditional outpatient group therapy to save a care manager 15 hours a week. This was coupled with a better patient experience. 90% of the patients were retained at the end of a 3-month period. With additional funding from Hopkins, the first version of our app currently has 1,000 users. And our first year in business saw us book $100,000 in paid pilots and secure 10 LOIs from later enterprise adopters. The existing solutions in the substance use aftercare space fall into a couple of buckets. 90% of them don't have any clinical validation. Newer technology platforms focus on delivering content and aren't engaging enough to reach those at highest risk for relapse. And of course, you've heard about the startups that are building bots or screening tools. But these don't have the engagement and empathy to actually follow patients through care, like peer support has been validated to do. Now, Now, my background before this was heading the sales at another company that sold software to hospitals. And my co-founder exited 2 AI startups before we met at Johns Hopkins, where we found our chief medical officer and clinical advisor, Dr. Daria, and our chief data scientist, Satya. We're also advised by accountants, entrepreneurs, business people, clinicians, and executives. That includes an ex-CEO of Magellan Health. Now, we're primarily bootstrapped to date, but we have received support from groups such as the NIH, Texas Medical Center, and Johns Hopkins. The next year, we'll see us build up a base of recurring revenue and put out 2 white papers on our clinical approach and novel AI tools respectively. The thing is, we have more demand than we can handle right now. So we're raising our first round, $500,000 pre-seed, more than half of which is already committed from institutional investors. If you or someone you know is passionate about our mission, reach out, and I'd love to talk about working together. I always end here, which is a quote from one of the users at our Hopkins pilot. Now, even though we were at one of the most advanced healthcare systems in the world, this quote basically talks about someone who finally opened up about issues they wouldn't even tell their therapist face to face. Even though we were in an advanced system like Johns Hopkins, we gave this person an avenue to reach out. And that's why I'm happy to be able to be here and share our mission with you all. Thank you.